Thank you, chairpersons. Distinguished colleagues, esteemed guests, and fellow devotees of HPB. Good evening. I bring you greetings from Amrita. It's my profound honor to address you all today on the Silver Jubilee year of the inception of the Indian chapter in this magnificent city of Calcutta, a place where art, literature, and medicine have danced together through the centuries like drunk old cousins at a big fat Punjabi wedding. Like many of you, I've spent decades navigating the complex landscapes of Hepato-Pancreato-Biliary surgery. Today, I wish to speak not about the technical aspects of our craft, but about something equally vital yet often overlooked. The humanities that make us human, even as we practice the most demanding of surgical specialties. I just got a rap on the knuckle by the president of the IHPBA that all orations are supposed to be delivered in 2 or 3 piece suits. So most orations are selected by the speaker being distinguished, but this one appears to distinguish itself by delivery by election rather than selection. Election to the post of the president of the Indian chapter. So as anticipatory bail and apologies for the raw deal you're getting, I promise we have much better and more distinguished faculty for the rest of the meeting. So traditionally, I shed those in deference to the humidity and humility. I opted for a single vestige of the vestments, my sole investment of the unofficial fashion designate of the officials, the pinstripe trouser. So I hope that satisfies the president. I actually wanted to label it Beyond the Scalpel, a surgeon's journey through medicine, humanity, and bird watching. But I thought it sounded a tad pompous. And then I thought of, putting it together like a field guide, but again, it sounded much like the Grimet's guides and all the other guides that you guys are familiar with. So I wanted to call it the Surgeon's Field Guide to Livers, Lives, and Linguistic Adventures. So is there anything common between HPB and birding? So pretty much like tracking this pretty Himalayan monal bird, spectacular when you actually spot it just below the snow lines, whether it's Kashmir or the Himachal or Uttarakhand. It's pretty much like the path of a HPB surgeon requiring patience, precision. It's a very neurotic bird, occasionally standing perfectly still in uncomfortable position for hours on end. The key difference is that birds rarely require you to list out post-operative complications to patients and their families, and still answer why a complication occurs when it does. So the single most important probably part of humanities is communication, what it helps us in, what the arts help us, the context, the metaphor. I'm sure many of you have always thought why the nerdiest, the toppers in your class weren't the most successful doctors. And over time, I've realized that all of us here are 12th standard pass-outs with an immense knowledge of human disease. For the lucky folks here, it's HPB. But is that sufficient? Is that enough? Having practiced in melting pots of the north and south and a bit of the west, medicine, like languages, has its own dialects. In the UK, a pain which is described as rather troublesome translates in medical terms to I'm in absolute agony, but would rather die than make a fuss. In Delhi, the same level of pain expressed through a colorful metaphor involving several generations of ancestors and their questionable life choices. So, in Cambridge, I had this senior who said in a tough liver resection, a few buckets had flown, the blood bank had emptied, and the anesthetist was sort of checking out whether the patient is still alive. He says, a rather sticky wicket we got ourselves into, wouldn't you say? So I think it's how you take things there. The art of communication is extremely important. We surgeons often fancy ourselves as pure scientists, as though our hands were guided solely by anatomy and physiology. As Woodhouse, my favorite humorist, would say, the surgeon who ignores the humanities is like a man who attempts to prepare a souffle while wearing boxing gloves. Technically possible, but hardly advisable. Our patients are not merely fascinating collections of organs waiting to be rearranged, though some do present themselves like that. They're human beings with stories, fears, occasionally the most improbable explanations, and some may be more important in diagnosis and decisions, which may not even fit guidelines. I remember, about 2.5 decades ago, when Kashmir was going through a lot of problems before Sadaf and Omar and all started doing shunts there, we used to do a whole lot of prophylactic shunts because people were scared that, if there's a curfew, they won't reach a hospital. So, contrary to all guidelines, we used to do shunts prophylactically as well. So I think there are a lot of metaphors we use in medicine which are useful in communication, and it's really worthwhile knowing what the patient is. So if you want to connect up to the patient, you can use a variety of metaphors. I like to use for cancers, I like to use the terrorist or a war paradigm, where surgeons like the army guy who has to conquer the territory, occupy the territory. The chemo is like the Air Force, which puts in neoadjuvant therapy before or wraps up all the other guys left over as adjuvant. And radiation is the Navy occasionally has options if it's available. It's important to engage patients on their own turf and crucial to earn their trust in that process. If it's a civil engineer, you can give them a paradigm of a flyover, and you can have all the best designs, but if your contractor is corrupt, the flyover might come crashing down. For a fisherman, you might give analogies about nets and rivers, and likewise for a farmer, for plumber is the easiest because you can explain plumbing. I think it's very, very important to have trust build up through your conversation, because we here are very used to having a cut and dried, come in, what's next, what's your problem, and how do you deal with it. But if you make a sort of a connect with the patient, what I've noticed is they accept your decisions without a worry. There's a patient from Kolkata I just did couple of weeks back with a post-LAR ileostomy closure had a leak. And he's completely, he says, we trust you. His brother's a doctor here. They all ring up and say, we trust you completely, because we had a whole long conversation about Calcutta, West Bengal, all the Machher holes and everything else. Very important to be, I think the complications can take us all day, and I think are important enough on its own. So important to be truthful. I've not seen a single legal complication if you've explained it pre-post, after, either before or even if you haven't, because many of you youngsters are scared that if I tell the patient, he's going to run away. I've heard a lot of seniors say that if I explain every complication, that hasn't happened to me so far. But at least after the event, put that injury as a possibility. Don't say it's a Miridzi or a CBD stone or whatever. And avoid paternalism. So what's the role of humanities? It teaches us how to communicate with the patients beyond just medical jargon. A clear, compassionate communication is vital for the patient's understanding, trust, and for him to make an informed decision. Sometimes we are so focused on telling our patients the technical details of their surgery that they might leave the consultation thinking we're discussing a new recipe for an exotic dish. So, doctor, you're going to resect my liver, but will it still be edible? So, exposure to arts, literature, history, ethics can make surgeons much more mindful, much more compassionate, and not just have excellence in the theater or the lab, but are actually emotionally unavailable robots. I remember this surgical oncology friend from Calcutta who was operating an octogenarian with a lot of comorbidities as usual, and the guy was spouting Tagore at his most depressive. And this guy, who's also read Tagore, gave him some of the most peppy lines to buck him up. And as expectedly, he had a fantastic recovery, didn't succumb to any of those other problems, and had a smooth post-op recovery. Another important place, I think, where we lack in this country is communication with each other. Team building, again, is a separate topic, and I'm not going to go there. But for the association, I think it's important to appreciate the importance of regional cooperation and collaboration. Surgeons across India can learn from each other's experiences and contribute to building a more holistic approach to patient care and medical education. There's no doubt, as you saw in all the sessions prior, that we are some of the brightest, most talented, most skillful, and very humane members of IHPBA in the world, hands down. But how are the Dutch different from us Indians? I think we need to take a pledge that we cooperate selflessly, beyond just a few papers, Dr. Jagannath, who's there, started the NET registry. Dr. Balakrishnan in Kerala had the IPANS, the chronic pancreatitis study. We've collaborated in some other studies. Shailesh is doing one on portal vein resection, about to be published. So, but beyond that, we need to go much more. The potential is immense. Our onco colleagues are probably better, and I think we should join them rather than worrying about naming and how to, get one up over them. So, what is it different about the Dutch, who produce so many trials? The area is only the same as Kerala, less than half of West Bengal. The population is about half of Delhi. India is about 1.43 billion. The number of physicians just above 60,000. We add twice that every single year. Yet we change our practices dictated by their trials. Some of the best trials, some of the most pragmatic trials. What do we need? I think we need standardization. We need the ability to avoid dissent, avoid the hierarchies and the entitlements and the consensus building measures we need to do. Stop the innate divisive tendency, the vestiges of the caste system which we still have. Teaching, non-teaching, government, private, MCH, DNB, rural, metro, gender, sexuality. I think we are past masters at dividing each other. We keep blaming it on foreigners. I don't think we need them at all. For us, it's also a tool for personal reflection. Surgeons can use medical humanities, particularly literature, philosophy, history, for personal growth and reflection. And this can lead to less burnout and greater satisfaction in their practice. It's very well known that hobbies or alternate interests which actively utilize your brain, not passive couch potatoes, but which actively use your brain. And teaching, I found teaching a fantastic way to keep young. Mind games, meditation and yoga are fantastic to buck up your endorphins, exercise as well. I think it's important to stress on the importance, I think Osler, who is known as the father of modern medicine, basically emphasized on the art of medicine. And subsequently somewhere, in the earlier part of the last century, we switched to more and more science, and we looked on all kind of the humanities as unnecessary. I was part of this study which with the Imperial College London, with the Grooteschouw in South Africa, and a couple of other hospitals, which was on antimicrobial stewardship. And what they were looking at is the PESTLE framework. They're looking at only the T is technology. They were looking at the political, economic, social, legal, environmental impact. They looked at the ethnographic. They went and interviewed all the people. They went on rounds seeing who's making those decisions, changing the antibiotics, how rational it is. And we came out with some fantastic studies. It's the only time I've actually been invited by the BJS to write a leading article on the same, and another one which is about to come out as well. So I think it's very, very important that we look at all these with a social science approach. If we look at the psychology of why we are doing what we are doing, in cancers, we are so bound to the guidelines. As soon as the latest monoclonal antibody comes, we sort of feel obliged that we have to use that as part of our armamentarium. It's important to look at the impact it's going to have. So if you haven't connected with the patient, if you don't know what his background is, he might be able to afford, for all you know, in Kerala, they used to come in a simple munda, and, they had all the relatives in the Gulf, so they could afford it. And whereas somebody who, comes in suited booted might actually be fairly, he's spent all his money on the pomp and show of that all itself. So are we thinking of sustainability in our theaters and wards? Are we looking at the environment impact of, we've been taught, Akiyama said so, that we must wash our hands with 300 liters of water, and that is much better than any other, antiseptic. We've had level 1 evidence that alcohol is better than soap. Why aren't we using that? And water is going to be one of the major commodities we're going to have an issue with very, very soon. So I think we need to start thinking. We're using disposables like the West, blindly. We don't have those same, for them to sterilize, and the manpower is much more expensive, so it makes sense for them to wreak havoc on the planet by the plastic explosion. But do we need to follow suit for every single thing? If we don't dispose of the scalpel handle, why should we dispose of every other instrument as well in laparoscopic, robotic, and all the other surgeries? We need studies on delivery of teaching methods and assessment, and are they really delivering only a glib person with good English and smart replies? Are we really assessing, the Sup is not here, but he's been responsible for the CBME curriculum, which is now in force, and they're actually looking at skills-based and other assessments as part of it, rather than the, just the kind of exams and coursework we are doing. And I think IHPB has done a fantastic job. Biju's been extremely proactive in setting up a lot of courses, the skills courses, as well as other things which are lacking in our students and are not given in traditional classes and their coursework itself. Are we serious about gender and sexuality? This was brought to me when I questioned my plastic surgeon in Cochin about my yoga guru, who told me that he wants to have a gender reassignment surgery, and I took him aside and said, "What a mutilating surgery! Do you think you really need it?" And he took me aside and explained to me. He said, if you have you get up in the morning and you find you have lipstick, a red sari, what will you feel? I said, I'll wipe it off. He says, they go through that. And it hit me every day after day after day. And I was very insensitive, and I think all of us are. We use a whole lot of terms, sixers, chakkas, all those things. I think I never realized what those people actually feel. And another plastic surgeon I talked to, actually, when I told him, are we doing it here? He actually said, how do we know this guy is not going to change his mind tomorrow? And I realized we don't need just that skilled plastic surgeon who can do the job. We need a mature sensitivity of the entire issue. Are we looking at, we lots of times glibly say, oh, we are treating our female colleagues well, but ask every single lady in this room what they felt at some stage of their life. So I think we need to really look, and unless we see, we are blind to it. We're not actually aware that I wasn't aware of my attitude towards all this. And subsequently, for the Journal of Medical Evidence, we did a special issue on the LGBT issues and another one on the women's issues as well. So are we good role models for a complete human outside of the OR as well? About 2 weeks back, I was at the convocation of the KEM hospital in Bombay for my son's MS graduation. And I stayed on for watching Chetan's graduates, and I found I couldn't help taking a pot shot at this photograph where, what it says is so nice. I was so thrilled that, Chetan, he's able to say this. And, probably because Chetan, Prabhu and Sharvari are good role models, that this guy actually has to say that. But look at the unsaid. What are the others feeling? How we have systematically denigrated family life and everything, it's systematically brought down, and we try to tell them that this guy is forced to put it like that. I'm proud of him and of Chetan as well. So how do we do it practically? So I think many of us read books, watch movies. I've personally started about 4 film clubs at Amrita Cochin, at AIIMS Rishikesh, at the Kedla Museum in Cochin, as well as in Amrita Faridabad. And these are some of the, the movies. Patch Adams tells you about not just ethics, but about how to approach a patient, looking at him holistically rather than just the disease. Miss Evers' Boys about the Tuskegee experiments of syphilis in the US on the blacks. My Sister's Keeper is raises questions of ethics about a young girl who's a donor for her sister all through, and she's doing a case against the parents. And the parents say mother is a lawyer who says she doesn't have consenting rights. So how just imagine science and the legality supervening actual ethics and morality itself. As Zindagi was a fantastic movie from India. We did the premiere at Amrita Faridabad. We had Sunil Shroff, Dr. Nandi, the director from the US all join in, and a lovely discussion followed, which actually increased the awareness in our part of the NCR area a whole lot. Many others. My brother Nikhil is on the AIDS issues. A fantastic movie from Japan, Okiribito, on a funerary. You know how this guy doesn't want. He wants to be a doctor, but he's forced to do this, and the dignity of the profession involved. UCMS and the army have done a lot of the theatre of the oppressed, role plays, case studies, creative writing. I think that automatically gets your creative juices flowing, and you start using humor as a way to deal with tensions and all that. Reflections. I think if you reflect, that's half the. Many people here I know Ramesh actually keeps penning thoughts and all that. Artwork. I see a lot of people. For them, it's comics and cartoons are a fantastic tool. Marvelous medicine is one thing which I discovered, and I think we have Pata here, who Learning General Surgery, who set this up along with Vidya, an anesthetist, and it's one of the a fantastic resource where they pick up eclectic topics on medicine, aviation medicine, deep sea medicine, a whole lot of things, high altitude, passions of doctors, how medical and surgical pedagogy, each time it's a different thing. There are lots of articles on this which we should keep abreast. We tend to just look at only the randomized trials. This is a fantastic book which is a primer for the Indian, in the Indian setting. And Marvelous Medicine, we did a panel which actually the WHO also contacted us after that. And I think there's a whole lot of resources available. For me personally, bird photography has been, cleansing, detoxing, liberating. You see Nature's Symphony in its full form. It fulfills photography, the colors, which I think any fashion designer can be challenged at. The beauty, inner beauty, outer beauty. It satisfies my passion for travel, including for food, exotic food, tasting, cultures, and also creativity. So we were talking about AI. So this part is the actual photo, and with this, the rest of it is AI generated. So just for this session. So sometimes you have to step back and see that, are you part of the art, or are you, look at the bigger picture. We're just a small part of the microcosm, and the hubris and, the thing we have, we don't realize the moment we are gone, we are gone. So I think we need to leave a legacy for the next generation, which is very important. And as we continue to advance our field technically, with robotic innovations, new approaches to minimally invasive resections, enhanced recovery protocols, let us not forget to simultaneously deepen our understanding of the humanities that make our technical expertise actually meaningful. For it, it's not enough to be skilled with a scalpel if we cannot connect with the human holding the pancreas, liver, or biliary system we seek to repair. I thank you for the patient listening.
We would like to thank Dr. Puneet for such a fantastic oration. Since this is a presidential oration, there are no questions. Thank you very much.
Thank you.
Sir, citation is there.
Thank you very much, sir. Thank you, Puneet.